Well, hello. My name is Maddy, and I was fortunate to work with Luna, Child and Youth Advocacy Center, for my practicum here in Calgary. Luna provides a safe space for children and youth who have experienced any form of abuse to disclose, provide remote testimony, and have medical examinations completed. Luna has a highly skilled interdisciplinary team that collaborates to ensure the child can provide the necessary information to hold individuals accountable for their actions and ultimately heal from their maltreatment experiences. There are dedicated child abuse detectives and officers from the Calgary Police Service who work at Luna to interview children and youth and investigate these specific situations. There's also a team of 3 RCMP officers who work out of Luna and are specifically trained to conduct child forensic interviews for neighboring cities and towns. Luna also has Alberta Health Services therapists on site who provide counseling services to children who have come through the center. Luna is also partnered with Alberta Justice and Children and Family Services to ensure children are supported through the judicial process and are in a safe environment where they can thrive. The Luna team itself consists of researchers, a victim support team, a prevention team, an education liaison, and many others. The values of the organization are: we are one team, we are committed to diversity, we make a difference, and we strive for excellence. Within Luna, I'm a part of their victim support team. So this team consists of family support coordinators, a volunteer coordinator, a victim services manager, a child life specialist, and court support coordinators. I was extremely lucky to be working directly with the child life specialist, as this is the profession I am pursuing. A key aspect of my role within the center is performing the child life introduction to children and youth who are at the center to be interviewed. This introduction consists of asking the child or youth if they know why they're here at the center today, explaining that they will be meeting a police officer who will be asking them some questions, and showing them pictures of the room they will be going into. During this introduction, we also assess the level of anxiety and stress the child or youth is feeling and provide specific coping techniques to support them. This may consist of offering the child or youth visit toys, such as a stress ball or pop-it toy, and coloring materials within the interview suite. It is also during this time that we try to create connections with the child and youth with the hope that they will feel more comfortable in the center. My supervisor and I then take the information we learned about the individual and pass it on to the detective who will be interviewing the child or youth. I inform them of the child's demeanor and relaxation techniques we believe will be helpful within the interview. At Luna, there are many different family dynamics and socioeconomic levels that are present within the center. A gap in services that was identified was the lack of affordable extracurricular activities we could introduce to families. When a child goes through trauma, a holistic approach to healing should be taken, and therefore finding hobbies that make the child or youth feel good will ultimately help them in their healing journey. I began curating a document that outlined specific programs around the city that were at no cost or were fairly affordable. I was also able to identify organizations that offer grants to low-income families that they can put towards a physical activity program of their choice. Another piece of my role within the organization was to provide therapeutic play and comfort to children and youth who are waiting or have completed their interviews. Within this child space, there are toys and activities that are abundant for all ages of children and youth that they can engage with. Those are some of the pictures at the center on that screen there. The public health and social policy values that have been able to guide and support me throughout my placement. A value I found particularly relevant to my work within Luna was collaboration across all sectors, including government organizations, nonprofits, and community groups. At Luna, they work in collaboration with Alberta Health Services, Calgary Police Services, RCMP, and Child Protective Services. I was able to directly witness how multiple organizations can work together to address and support an important cause. Collaboration between Luna and its partners is crucial in providing the required support for children and families and addressing child abuse allegations. In addition to collaboration between sectors, interprofessional and multidisciplinary approaches to practice also plays an essential role. I have been able to witness firsthand how many individuals it takes to provide the best care and support to children and youth in these situations. It has also demonstrated to me the importance of utilizing community support and resources to address each individual's unique needs and situation. Luna emphasized the importance of diversity and embracing Indigenous knowledge. They demonstrate this through their addition of an Indigenous liaison in the center and the sacred space in which families can support their traditional practices, such as smudging. The center's Indigenous liaison works directly with the community and elders to provide culturally relevant supports and resources. I was also able to participate in a blanket exercise while at Luna that was led by Indigenous elders from the community. I found this extremely empowering and was very grateful for the experience. It was wonderful to see the organization's commitment to learning and reconciliation. There are 3 key PHSP knowledge areas that were significant during my practicum. Firstly, the social and life course determinants of health do have an impact on what demographic of children are more likely to experience a form of abuse. Families with lower socioeconomic status are at a higher risk for child maltreatment. Theorists speculate that this is due to financial stress that can result in mental health issues and a change in parenting behaviors and family dynamics. Lower socioeconomic status can also impact the ability for caregivers and children to access needed social support and resources. The second knowledge area that was relevant to Luna is improving health and reducing health inequalities in communities. Luna focuses on the healing journey of their families. This means referring them to different programs and resources, as well as helping them with any immediate needs. This could include grocery store gift cards, gas cards, and any personal hygiene items that they believe would be helpful. The final knowledge area that applies to this specific organization is fostering effective multidisciplinary teamwork. Understanding how to work with others from different backgrounds and valuing their strength has helped me work productively with the large team within Luna. One of the calls for truth and reconciliation that specifically resonated with me was number 5, stating, "We call upon the federal, provincial, territorial, and Aboriginal governments to develop culturally appropriate parenting programs for Aboriginal families." This call to action pertains to my practicum organization as safeguarding your children from abuse and learning the skills to be able to support them if they have experienced abuse is crucial. Providing Indigenous parents with parenting programs that teach them these skills and are culturally appropriate and incorporate Indigenous knowledge and teachings would benefit the children and the community. During my time at Luna, I was able to learn an abundance of knowledge and gain insight into the inner workings of a nonprofit organizations and its partnerships with police services, health services, and Calgary's Children and Family Services. Being able to see how many roles are needed to enforce justice and provide support and resources to children and youth who have experienced abuse emphasized the importance of interdisciplinary teams. It was also through my practicum experience that I truly learned the power of kindness and emotional support. Within my role of introducing children and youth to the space and giving them information on what to expect from their visit, I was able to create a sense of comfort and offer support to the children and their caregivers. This may seem like a simple task and not a big deal to me, but it can make a significant impact on the families within the center. I've had numerous parents thank me for my role and for supporting their children through this experience. This emphasized to me how much of an impact we can have on individuals and families who are going through hardship if we meet them with kindness and compassion. During my time at Luna, I also learned a lot from my colleagues about understanding your capacity when working in difficult areas like child abuse. We may want to fix every situation and help every child who walks through the door, but as individuals, we are only able to do so much for the child or the family. Knowing what you can do and what is out of your control is extremely important. In terms of the completion of my public health degree, there are numerous key insights I will take with me during my professional career. One in particular is my understanding of the social determinants of health. I believe in our society, we are quick to judge individuals about the state of their health without truly understanding what has influenced it. Understanding that there are plenty of social factors that influence an individual's health is crucial when trying to develop healthier communities and populations. This program has also taught me how to work with individuals from all different backgrounds and how to be an active listener. Through all the group projects, I have been able to learn how to collaborate with one another and incorporate new ideas and perspectives within my work. Thank you.